Hello, everyone. I'm Perelman, and this summer I worked at the Mount Sinai Whole Family Center for Pediatric Endocrinology and Diabetes. I researched the growth hormone's effect on the disproportionate growth of hands, feet, and head with my mentor, Dr. Robert Rappaport. So some background about growth hormone. Recombinant human growth hormone was approved in 1985 by the FDA, and overall is safe. However, there are some common side effects such as headache, bruising at the injection site, and with some more severe ones as diabetes or slipped capitofemoral epiphysis, which is one you're joined with. Patients and their parents are informed that rare but serious side effects can occur. However, some side effects are unlisted, such as the disproportionate growth. Anecdotal reports of varying side effects of GH on hand size, foot size, and head circumference have been unreported by doctors due to the lack of information. Here's the growth hormone transduction pathway. It is created in the pituitary gland, where growth hormone then is traveled down to the liver, where IGF-1 is produced, and then the IGF-1 goes to the growth plate on the femur and then muscles in order to induce growth of the body during puberty. So our goal was to create a dialogue between patients and parents, so patients, parents, and their physicians in order to better understand the risk benefit factors that go into making a decision to undergoing growth hormone treatment. So the question that we asked was, does growth hormone cause disproportionate growth of the hands, hand, foot, and head? The method for doing this was we performed a literature research using PubMed and Google Scholar since growth hormone has been FDA approved, which was in 1985, to the present. So since growth hormone is relatively new, the recombinant, since growth hormone is relatively new, allowing a very specific approach, I was able to use the Mount Sinai database this summer in order to find all the information that was needed. Of the 400 articles that I found, only 7 were pertinent to the data that we were looking for. And from that, we determined that SGA patients appear to normalize, and that patients with growth hormone deficiency and Turner syndrome have a disproportionate increase in hand size, foot size, and head circumference. These are the different articles that I found. These 2 were for SGA, growth hormone deficient, and Turner syndrome. For the SGA, as you can see, they normalized. However, for all the growth hormone deficients, depending on the different factors that they analyzed, they all experienced disproportionate growth, as well as the Turner syndrome girls. However, there were a few problems with these studies, such as small study size. None of them evaluated anyone with ISS, which is idiopathic short stature, or a short stature with unknown etiology, as well as very few of these studies followed their patients to adult height, meaning that they would stop before they'd actually reach their final height. So I propose that further research needs to be done, as well as a prospective study that is being put into place currently in order to continue our knowledge of growth hormone and learn more about the effects of it, as well as, since there are so many patients that are classified as idiopathic short stature, I propose that that there should be a patient population that is followed for this criteria on disproportionate growth. I wanted to thank Dr. Bloom, Dr. Cox, Dr. Rappaport, Dr. Engelman, and the Mount Sinai staff.